So let's talk about the CDC recently reported rising STD rates in 2017. Why all of a sudden are people not careful about protecting themselves? What's going on, Doc?
So we don't know, but one of the suspicions is that there's actually increased awareness about long-acting contraceptives, so birth control. So now we're able to use IUDs and rods and things that keep us from getting pregnant. So people are using less caution when it comes to condom use.
Oh, no.
So what are you talking to patients about when someone comes into your office? What are you trying to get them to understand about STDs and STIs?
So first off, I ask every one of my patients, literally everybody, do you want an STD screening? And I actually ask them and I say, I ask everyone this because some people say, perish the thought, why would you ask me that? And I'm like, listen, I ask everybody, married, single, I don't care. I'm going to ask you if you want an STD screening. Often the next question they say to me is, well, wouldn't I know if I had something? Would you?
You tell us, doctor.
I would hope so. I mean, a lot of people just assume until something like draws a red flag, there's no reason.
That red flag is that red on my sheet of paper when I get your results back, because you often do not know. And one of the most commonly spread STDs is chlamydia. It's 50 to 80% of people who have chlamydia have no symptoms.
Oh, wow.
Yeah.
So
really
what do you do if you've been married for 10 years or you never know what another person's
like I'm in a
doing,
relationship
but
for a
you
long
think
time.
that it's actually
So we
a
don't have to worry.
monogamous relationship, but you never know what a person is doing.
I don't judge a person who says, you know what, let me just screen just in case. It's not that they're doubting their partner. It's not that they're even doubting themselves. Some people have never been screened even within their relationship. I had a person who told me that she had been in like 2 relationships and now this one, and it's monogamous, but she hasn't been screened since the last time.
So it could have been a carry-on.
She could have been carrying something into the relationship. You don't know.
So how do you handle that if you are in that monogamous relationship, you had a partner for several years, and yet you come back with something? Does that automatically mean that that person that you're with hasn't been faithful, or does it mean what you're saying potentially?
It's possible that it's something that they've been carrying for a long time that just now popped up, like HPV is a really common one, human papillomavirus, that you can have for years and the test can be negative and then it can be positive, and that doesn't mean that there was infidelity in the relationship.
I feel like now you need like a counselor to explain what happened in your relationship too.
Yeah, right.
Because trying to explain no, I have been faithful, but where did this come from?
I think it's a reasonable time mark to say, you know what, every few years potentially, let me just test. I know on this date and time everything was fine, then we'll test again in a few years. Or maybe if you really do, feel really confident in your relationship, you don't need to test within the same relationship. But if you get into a new one, you should test anew.
But with all of these diseases that you're mentioning that don't have any symptoms, I mean, it's probably the best way to get just tested every so often.
I don't think it's wrong.
Okay, doctor, I feel like I know what you're going to say though, but is it typical, do you find patients coming to you together to be tested? Do couples come in and try to get tested together?
I think that couples come simultaneously to get tested to their respective doctors. Okay. I'm a gynecologist, so I'm not dealing with the men, I'm sorry. Okay. But I will test the woman, and he can go to his doctor and be tested as well. And I think that that's reasonable. What I don't like is when people say, well, I was tested, and then we got into this new relationship, so we were both tested, we were fine. Get tested again in the relationship, just to make sure that you can time mark and say everything is fine.
Because there could probably be long...
there's not enough, you can test all the time. There's not a limit.
Yeah, right? It's not hurting you, it's only helping you.
Exactly.
Are there long-term health risks to worry about, too, if you decide to say, no, I'm good, nothing's wrong, I don't care what Doc's saying? There are long-term health implications, potentially, correct?
Back to chlamydia, that's one that you can have for potentially a very long time, and it can affect fertility. We talked about that a few weeks ago. It's one of those things that, and especially like HIV or hepatitis, can have long-term implications on your health that in the moment when you have it, you don't necessarily feel or experience. Years later, you can have definitely health concerns.
Is there one that's more prevalent or more widespread now than the other ones out there? Is there one leading one?
Chlamydia is kind of it's kind of the big one.
Right now?
That's kind of the number one as far as the spread is concerned, yes.
Very interesting. All right, very sobering conversation right here. In all seriousness, this should be the red flag that you need out there. Don't worry about, do you have something that you can clearly see? Worry about what you just heard right here from Dr. Wendy, and you can follow her and read some of her latest blog posts on her site, dreverywoman.com.